Thank you, Chairperson. I'll start off. So this anterior quadratus lumborum block. So the quadratus lumborum block is a facial plane block. So the basis of facial plane block is that it's not a nerve block. We are injecting LA into myofascial plane so that it blocks the nerve that runs along this myofascial plane. So actually the basis behind quadratus lumborum block is a bit complex because it involves multiple interaction between a few myofascial planes. So, but basically, the reason why people do quadratus lumborum block is to block the nerves that supply the abdominal wall. So, yeah. So, the basis behind the anatomy behind this block is because number one basis is the quadratus lumborum muscle and the psoas muscle. Actually, it is the core muscle of our back. It actually transverse between this our iliac crest and then goes to across the diaphragm, and then it's actually connected to the paravertebral space. So that's one of the mechanism of this quadratus lumborum block. There are actually multiple mechanisms because. Then you must also understand that this quadratus lumborum muscle is surrounded by this thoracolumbar fascia. So this thoracolumbar fascia is a multi-layer fascia that contain all these abdominal nerves. So there are actually a few mechanisms. One is that when you do a quadratus lumborum block, you actually block the nerve to the anterior abdominal wall, plus there's also spread to the paravertebral space. But actually, all these mechanism depends on where you place your LA. So you look at if you can notice this picture, the quadratus lumborum muscle, the QL muscle. Sorry, the pointer, it's not showing. Never mind. The quadratus lumborum muscle is actually, if you notice that it's surrounded by the thoracolumbar fascia, and it depends on where you place the LA. So if you see on one side of the screen, if you place the LA lateral to the muscle, it's actually a posterior tap or a lateral quadratus. That will have different effect. And if you place the LA posterior to the quadratus lumborum muscle, then they'll have different effect. But today I'm going to introduce to you the anterior type, where you place the LA anterior to the quadratus lumborum muscle, which is also known as a transmuscular. Some people call it a transmuscular because the needle actually passes through the quadratus lumborum muscle. And the tip is between the quadratus lumborum muscle and the psoas muscle. So, because we are scanning deep into the muscles of the back, so usually we'll use a curvilinear probe, a low-frequency curvilinear probe, because you are required to penetrate deep into the abdomen. So patient usually will be in the lateral position. And sometimes, depends on patient's body habitus, you might need to use a long needle. Some people have used up to 150 mm needle. And because it's a facial plane block, you're not targeting a nerve directly. So that's why you use a larger volume of local anesthetic, anywhere between 20 to 30 mils of LA. So because you use that large amount of volume, you can't, sometimes you cannot use high concentration of LA. So the typical concentration of ropivacaine is between 0.2 to 0.375. In my practice, is 0.375%. And bupivacaine is 0.1 to 0.25. So patient will be in the lateral position. You place, in order to scan the quadratus lumborum muscle, you place the transducer at the transverse plane, at the abdominal flank, cranial, just above, slightly above the iliac crest. And then you move the transducer posteriorly, you slide the transducer posteriorly, keeping in the transverse orientation, and just tilt caudally so that you can, the beam will be, you'll shine on the L4 vertebral body, all right? So this is sonor anatomy of the quadratus lumborum muscle. So what we are trying to identify here is this actually, that is the anterior abdominal wall, and that is posterior. So from the deepest structure, that's the vertebral body and transverse process. Above the transverse process is the quadratus lumborum muscle. So yeah, people have described this as the shamrock sign. Huh? Yeah, the three muscles form the leaf of a shamrock. Okay. So yeah, so the needle is inserted in plane. Okay, and the tip of needle is advanced through the quadratus lumborum muscle, penetrating the ventral fascia of the quadratus lumborum muscle. So the LA is injected between the quadratus lumborum muscle and the psoas muscle. So yeah, some tips, because this is you are using a low frequency probe. So and then you need to identify the transverse process. So sometimes you need to tilt your probe cranial caudally to get the best image, and then sliding the probe anterior and posteriorly to identify, to differentiate how do we differentiate the quadratus lumborum muscle from its other structures? So sometimes the quadratus lumborum muscle will appear very thin when you shine from the anterior aspect of the abdomen. Then as you slide posteriorly, it becomes more like the shape of like more maybe like smaller on top of the transverse process. And then it doesn't move with respiration, while the other structures in the intra-abdominal structure, like the kidney, the perinephric fat, will move with respiration. Then there's one more problem. Sometimes, because if you place your needle too near towards the spine, enter paraspinally, sometimes you can accidentally puncture the thoracolumbar artery. So it is advisable to put on the Doppler to identify the artery first. So next I'll be showing a video of this block being done. So yeah, in this patient I've identified the iliac crest, and then I'm placing a low frequency probe just above the iliac crest and tilting and sliding from anterior to posterior. So you have identified the internal oblique. Anteriorly, that's the anterior oblique, internal oblique and transverse abdominis muscle. And then as I slide to the back, then I also need to highlight actually the intra-abdominal structures like the perinephric fat and the kidney. Okay. So as I slide my probe posteriorly, then you notice the vertebral body, the transverse process, and around this transverse process, above the transverse process is the quadratus lumborum muscle. Anterior to the transverse process is the psoas muscle. Posterior to the transverse process is the erector spinae muscle. Okay? All right. So, yeah. Then, next is we will advance the needle through the quadratus lumborum muscle to place the tip, between the quadratus lumborum muscle and the psoas muscle. So next I will, next is the video of the block being performed. As you can see, the needle is coming in from the actually lateral aspect, and piercing through the quadratus lumborum muscle, and the tip is placed between the quadratus lumborum muscle and the psoas muscle. Okay. All right. Yeah. So as you can. Oh, sorry. Okay. Sorry. Can I reverse? Oh, never mind. It's okay lah. So okay, that will be the end of my talk. Thank you. Thank you very much.